Good morning, everyone. Brandon and I created a training for cultural competency for you guys today. It's a brand new training, so we're super excited about presenting it to you guys. So the learning objectives from this training are to define culture and cultural responsiveness, explain why culture matters in ABA, identify barriers to culturally responsive care, apply culturally responsive strategies during service delivery, and recognize the importance of compassionate care. Go ahead, Brandon. We'll go just back and forth.
All right, cool. So obviously here, what exactly is culture? And this term has it's an important meaning for all of us in our practice and our everyday life. Everybody comes from different backgrounds. They have different experiences, experiences that kind of shape the way that we are now. And it's important to be able to take like a kind of a step back and understand what traditions and values other cultures have in place that might change some of the ways that we go about our interventions and also the way that we communicate with families, and kind of also understanding like things from their perspective in like an empathy kind of term as well. Um, so first off, culture, as it says here, is defined as a set of ideas, practices, and ways of living that characterize a particular group or society. Um, and in our daily lives, we see all different types of backgrounds, and like I said, there might be different ideologies too that come behind some of these diagnoses. There was one article that I read once saying that back in the day, used to think that people with disabilities were possessed and they weren't treated the best, and um, there's different things here that we can speak about too. There's, obviously different ways of speaking. There's language, religious preferences, and ideologies. There's family values, traditions. Sometimes in some families, if they invite you over to the house and you go in and you eat their food, or you decline the food, that could be considered, disrespectful. Which is why it's important for us to kind of take a step back and understand these values. Disabilities as a whole, how do they value disabilities? Do they take it serious? Do they think it's a phenomenon, like a natural thing? Is it science, thoughtful? There's socioeconomic status, gender identity, which we're seeing a little bit more so in our culture today. And also there's community beliefs and what we all kind of, value as an important as a whole as society too.
So why culture matters? Culture matters because communication, preferred reinforcers, family expectations, treatment goals, daily routines, and participation in services. So the one that stands out to me is like family expectations. And later on in like the PowerPoint, we have an example to talk about amongst all of us. But when you go into a home, it's super important for us to be respectful of the family, respectful of the VIP, and to really consider their culture and consider what their beliefs are. So, for example, if you're walking into a house and maybe it's I don't know, the VIP and their family are of Asian descent and they take off their shoes. It's super important for them to take their shoes off when you walk into the home, and it's considered disrespectful if you don't. That would be something to consider when you're going and doing these home visits, is to make sure that you are able to be respectful of their beliefs for something like that and take your shoes off. And we'll get into all of these a little bit more as we go.
So, as it says here, culture of humility really means just kind of recognizing that we'll never know everything about another person's culture. This all kind of, it just requires like lifelong learning, self-reflection, um, asking questions respectfully to the family too, I think is important. When I think of humility, I think of like I'm always willing to learn. It's not like I'm never going to know everything. I'm never going to know, oh, don't worry. I know that you guys had these experiences and I can empathize with you. I know exactly what it is that you're talking about. I think it's important to go in with like kind of say maybe like a clean slate, like an open mindset, and that I'm willing to learn about a new culture. And it says here self-reflection. So, what is it that I did today that maybe I can improve upon next time? Maybe I could ask the family, what their preferences are. Like Grace was saying, oh, I'm sorry, maybe you want to take, my shoes need to come off at the door. Is it okay if I put my backpack down here? Just like almost like a guest. You really are just a guest in somebody else's home. And the way that I would want someone to respect and treat my house is kind of the same way that I would want to go about myself. Um, and moving forward that way. Definitely, it's important to ask questions, and don't be afraid to ask a question, even if the response we really can't control what somebody else is going to say. But sometimes the family might, appreciate and respect that. Okay, this person's willing to learn about my culture, and there's a very sensitive field I feel like that we're in, and it's very like emotionally driven, and you have to be a little bit vulnerable to be able to let an agency like RBL into somebody else's house. And, there might be some anxiety there. And then if they see that somebody's willing to, come in with an open mind and learn about their culture and the preferences, they might be able to get maybe a little bit more of a buy-in and also kind of make sure like we're addressing socially valid concerns as well. We want to make sure that we're avoiding assumptions, which is kind of the opposite of thinking that, that I know everything. I don't want to assume it's, oh, I know they're from this area. This is the way they're going to be. Or I know that in the past I had this experience. I hope this doesn't happen again. It's important to kind of go into with that clean slate mindset. Responsiveness is, what is it that I'm going to do with the information that I've gathered? Um, Applying what I learned, going off that example, like what Grace was saying, I learned that they want to make sure that, my shoes come off of the door. I'm going to also make sure that I do that consistently as well. Adjusting the treatment as well to what they value as a whole. Maybe you can kind of, I don't want to go in there and you want to say like guns blazing with my own ideologies. And we're going to make sure we use this communication board, no matter what. Um, Kind of meet them. Maybe they value, maybe it's something that they want to teach their child how to, maybe it's praying or how to cook a food properly, following like their guidelines, and adjusting those treatments kind of, efficiently and appropriately to what it is that they would like. This kind of goes without saying, collaborating with families. We already do, I feel like, a really good job at doing this as well. But sitting down and making sure that we're understanding their values, what is it that they want? This is another part of that applied in that socially valid aspect. And as always, just respecting cultural values kind of goes in without saying. We'll get a lot more buy-in and potentially maybe better treatment results if we're understanding about what their values are, and also moving forward from there.
And one thing I want to add with this slide is there is a section of the FBA that says cultural considerations. And if this is something that while you're doing your FBA assessment that you come across, maybe the family mentions that they have, a request that's due to their beliefs and their culture that they would like for you or, the treatment in general to follow, that would be super important to put in the FBA section so that not only but maybe if the case gets transitioned to someone else, they would know. Or if you have RBTs under you, or maybe direct support staff from another agency or nursing staff comes in, then they would know this information as well. So it's super important for everyone on the treatment team to really know and understand what this person's culture is and like what their beliefs are and how we can be as respectful as possible to their beliefs while we're servicing them in the home. Common barriers. Cultural blindness is one of the common barriers. Another way to think of this is I treat everyone the same. Cultural blindness is the assumption that treating everyone identically is fair. It does not recognize that people from different cultures may have different experiences, values, needs, or barriers. Ignores important individual differences. So a good example of this that I found was a BCBA writes a goal for a child to independently greet adults with a handshake because that is considered socially appropriate in their culture. They do not discuss the family's customs, culture, or preferences. So what is wrong with this example? Does anyone want to tell me about this specific example and what is wrong with it?
They may be accustomed to a different greeting.
True. Yes. And there's some, religions where a female cannot shake the hand of another male except their husband. So, that's something to consider too. I believe it's the Muslim culture, but I might be wrong. Um, and sometimes even within their culture, they just don't like handshakes in general. Maybe they don't find that to be respectful. So something super important that the BCBA should have done here was discuss the family's customs. Ask the family if greeting by handshake is something that not only respects their culture, but also is important to them, is an important goal for them to be greet this way. Maybe instead they can greet saying hello, waving, so they don't touch another person. And the BCBA can consider other ways of greeting instead of just using a handshake. But the fact that, BCBA in this case was not considerate of what the family would want with a specific intervention strategy. And that's what's wrong with this example. And that's an example of cultural blindness.
Nice. I mean, I feel like a lot of us are kind of getting a similar theme here. That it's important to look at other people's perspectives just in life and also with this culture thing. So the next one is going to be common barriers for cultural incapacity. Essentially, it's just a limited ability to understand, respect, or respond appropriately to cultural differences. Generally, it occurs because of unconscious bias, stereotypes, or the key word here is really a lack of knowledge. Um, I can remember when I first started in this field, whenever it was that a couple years ago, um, I noticed we had, a pretty diverse population in terms of diagnoses and also cultural backgrounds that it took me a little bit to make sure that, when I came in the door, that I wasn't already kind of having like a preconceived notion about the way that people were going to either treat me or that the way, I think it's a combination of like humility and also kind of letting go of my preconceived notions, if you want to think of it. Because I mean, we learn in this field that all my experiences and the things that I know now are based on my own like learning history. And if I can incorporate some kind of if you want to say like an intervention and making sure that I'm staying open minded and also willing to learn about other people, then those preconceived notions might be able to dissipate, and that way I could kind of effectively treat people, the way that they are now. And I like to do this even in my personal life as well. I think it's a really strong tool that we can utilize really across the board. So here's a case example. There's a healthcare provider that assumes that all families have the same beliefs about medical treatment. I'm sure some things are sticking out to here, and does not ask about a patient's cultural preferences. As a result, the provider recommends a treatment plan that conflicts with the family's values and decreases their willingness to participate in care. Reading this example, what do you think we could have done differently? Or what do you think some of the problems are? Anybody could share. I can give you a hint here. It has to do with maybe practicing a little bit of humility.
They could have asked about cultural differences and the treatment plan.
Yes. Yes, very good. Thanks, Joanne. Appreciate you sharing. It's good to hear from you too. Um, yeah, I mean, this is like kind of reminds me of our practice now. Like we come up with a treatment intervention, we come up with a behavior support plan, and it's important for us to be able to review that with the family before, we actually implement some of the interventions to make sure that we have the buy-in from the family. And also, I like to think of it as if this is a practice that the family is never engaged in, and how is this really custom and tailored to the needs of the VIP specifically? Um, might not really it may not work as effectively as something that is common within the family. If I can kind of incorporate that in my own behavior plan, it might be more familiar to the VIP itself, and that way we could kind of get or address some of those natural motivators and those cultural variables to be able to come up with a more efficient treatment plan.
Yeah, and I think another thing to note with this example too is, okay, this healthcare provider made a mistake. They should have asked the family about their cultural preferences before recommending a treatment plan. But now that they did recommend a treatment plan, some cues might be, that the family maybe asks a lot of questions or seems little bit resistant to the treatment plan, or they're not doing it at all. That's kind of some cues to be like, okay, well, what are the reasons? What could be the reasons that this family's not participating, or that they're so resistant to the plan? And that's like a good opportunity for you to bring up the plan again and talk to them again. And then you can ask, is there any barriers here, as far as this treatment plan is considered? What could I do better? Is there a different, ask their opinion, is there something else that you think would work better for your child, or work better for the VIP? So even though, you make a mistake in the beginning, it doesn't mean that you can't go back on it now. There are many opportunities to go over the plan, and if it should be a like a prompt for you, if they don't have a willingness to participate, that should prompt you to review the plan again, and check for that social validity. I'm always getting the short slides. How culture impacts services. Culture can impact services by our treatment goals and what we choose, reinforcers that we're choosing, prompting procedures. That's specifically, if in someone's culture, they don't want any staff to touch the VIP. Maybe a full physical prompt is not going to be a great prompt to use. Parent training, acceptance of services, which we went over a little bit, and social validity.
Next up is, what is it we can do to try to, meet somebody else with their where they're standing with their culture. This slide here is just more or less about compassionate care, and I kind of spoke earlier about making sure that we're acting on empathy as well, providing compassionate care, making sure that we're actively listening. Um, and I see a lot of people at work do a really good job with this, but I think it's important to make sure that we're showing somebody else that we're understanding what they're saying. Like nodding my head, and sometimes almost repeating back what it is that I heard, to make sure it's like, I want to make sure I understand what you're saying. What I'm hearing is, X, Y, and Z. So that way the person understands, okay, so they are understanding what I'm saying. They're hearing me out here. Practicing patience as well, to understand that, there's a lot of stressors going on in the family. Behind the scenes, there might be a lot of, he just keeps doing this. He keeps hitting me, and I can't take it anymore. Like reassurance and patience can go a long way. Understanding that where somebody else is coming from is part of that compassionate care that we're talking about. And I think we really make sure that we value this a lot in our practice now. And then that professional humility also has something to do with it too, ensuring that we're willing to learn from our experiences, to reflect, like we were saying back on that other slide, and kind of incorporate everything that we learned into the actual treatment that we're doing now, and how we interact with the family as well.
Agreed. And some other ways to really like practice compassionate care that we're actually talking about more recently in school, is, stop and listen, which is kind of that active listening piece. Is just don't interrupt the family when they're talking with you about frustrations or concerns that they're having. Let them talk to you, and let them get that out. And then also like validate their feelings and come from a place of understanding and empathy. And really show them that we're being as understanding as possible, and we're coming up with solutions to try to give them not only, their child or the VIP, better quality of life, but also I would bring up giving the family a better quality of life. Nobody wants to feel like a prisoner in their own home. So it's not, our service isn't just for the VIP. If you really think about it, it's also for the family as well. So we want to show this compassion for the VIP, for the family, for everyone involved. I'm just going to do the next two slides. I keep getting the small slides.
That was
Practical.
good.
Sorry, Brandon. Practical strategies, asking open-ended questions. This is good, so you don't just get a closed yes or no answer. It gives the family an opportunity to go more in depth and talk more. about, their culture. Maybe you'll get a lot of answers to questions that you wouldn't think of asking, even through one or two open-ended questions. Learning family preferences, we talked a lot about that. Avoid making assumptions, which I know Brandon touched upon. We don't want to assume. You know what they say about that. So don't assume. It's better to just ask. Always better to ask the question. And I think the family would be more appreciative of someone asking about their culture and genuinely wanting to learn, instead of just assuming. Use interpreters when needed. Seek supervision. Always talk to a BCBA. Seek supervision. Individualized treatment. Of course, we want to individualize our treatment plans, our behavior support plans, for that specific individual. We do that anyway, but that's another important point here. And respect family priorities. Like Brandon mentioned earlier, we are guests in their home. So, if you think with the roles reversed, like you want someone to be respectful when they come into your home. So you have to think the same way. Be as respectful as possible when you're going into somebody else's home. Brandon, do you want to read the scenario? This one's a really good scenario to talk with it, have everyone talk about it.
Yeah. The scenario: balancing treatment goals with family values. Okay, so BCBA Sarah provides in-home services to a 7-year-old client named Malik. Malik's family is very involved in his treatment planning, which is great. During the initial assessment, Malik's parents shared that their primary goal is for him to increase independence in daily routines. Okay. Treatment team develops goals related to increasing Malik's independence with self-care skills, including getting dressed independently in the morning. During sessions, RBT notices that Malik's mother frequently helps him choose his clothing and assists him in parts of his dressing routine. The RBT working with Malik says to the BCBA, his mom keeps doing things for him. She's not letting him become independent. We need to tell her to stop helping him. During a conversation with Malik's mother, she explains, in our family, helping our children is an important way we show love and care. I want Malik to learn independence, but I also want to continue supporting him and being involved in his routines. Number one, and anybody can chime in, please. How should the BCBA respond to the RBT with all these things that we just kind of talked about in mind? What do you guys think?
That the wishes of the mother should be respected.
Good. Yeah.
Yeah.
Well, if the RBT came, say you're the BCBA, and that RBT came to you and said, his mom keeps doing things for him, she's not letting him be independent, what would you tell them in that moment? How should you direct them with their thinking in that moment?
I was going to say maybe just obviously respect their decisions, but remind them that what the goal of treatment is and how important buy-in for learning these skills are for later on in life. So if they're not also assisting with implementing the plan, then you're not going to see the results you actually want. But in a respectful way. That's kind of a generic way to say it.
No, I agree. Joe.
I maybe would like revisit the goal again with the family during like the FBA. They mentioned they would like him to become more independent with daily routines. And I would ask them kind of like what that exactly looks like. What does that look like for the family? What would a successful outcome be for my work with them, and kind of revisit that to see, kind of get more of a glimpse into what they meant by more independence and daily routine. I'd also warn the RBT not to make assumptions like on your previous slide. And we always talk about this is making up a story about someone's motives, about why they're engaging in a certain behavior, and the RBT said she's not letting him become more independent. So I like how the BCBA went out and kind of talked to the mother again and found out kind of the truth about that story. It got better insight about exactly why the mother was kind of providing this assistance. So, I think those two approaches could be effective here too.
Agreed. Yeah, that's what I was thinking. My first initial thought was, what does independent mean for the family? What our version of independence is might not be the same of what their version of independence is. And what's important here is not our version, but theirs. So I think that's a really, really good point that Mike made. Okay, number 2, what should the BCBA do? What would you do in this situation if you were the BCBA? I know we touched upon it a little bit, but what do you think we should do?
Revisit the intervention and the cultural differences, and ask if there's a more effective way to implement the strategies.
Good. Yes. True. I was thinking here what the key word that Joanne said was, well, key words were revisiting the plan. I think we should do exactly what we mentioned earlier, but then revisit the plan and maybe write in here what independence looks like. And as I said earlier, there is a cultural consideration section, so you can write anything regarding the cultural considerations that the family has in that section. And then for this intervention, maybe you can kind of be a little bit more clear about what independence means for this family, and kind of focus your mastery criteria on what would be their version of independence. Anyone else have any other suggestions on what the BCBA should do?
I like these answers all. I appreciate you guys participating.
Okay, we'll move on. I mean, we kind of talked about that in both 1 and 2. So 3, how can the BCBA demonstrate cultural competence while still practicing ABA?
I think, to have like regular check-ins, like that we should all be doing, with the stakeholders involved, checking in, making sure, in the onset of services, when we have that plan, we're getting consent with our goals and our strategies. And then ongoingly, we're having these conversations baked into our consultation where we're kind of asking if the interventions are still appropriate, if they're still working, and kind of continue learning and tweaking the plan based on the feedback we're getting.
Yep. And I think, thinking through what the conversation with Malik's mother, this is like another example of showing compassionate care. Listen to what the family, actively listen to what the family is saying. Be compassionate about what they want, and then respect their wishes. Again, and we touched upon this a couple of times, but you're going to get more buy-in from a family if you follow the treatment goals of what they want to work on in their own home compared to like what we would want to work on. So I think that's important too, and that plays into compassionate care. Does anyone have anything else to add with this example?
Yeah, I was gonna say, um, you could also keep demonstrating cultural competence by continuing to ask questions about their culture, and then obviously respecting anything you learn and incorporating that into the treatments.
Agreed. Yeah, and I don't think a family would be unhappy with you asking questions and showing general interest in like their culture. I think a family would actually respect that. They would want that and want to be able to teach you and give you some knowledge and experience, about their culture. I feel like that's very respectable. So, um, when in doubt, ask.
And I think also you could look for outside resources too, like reading, listening to podcasts, those kind of things about different cultures could be like an ongoing way you could keep a growth mindset and learning about other cultures as well to keep yourself confident in that area.
Agreed. Very true. Any questions about this example? So some key some key takeaways from this training today is to remember everyone has their own unique culture. Cultural responsiveness improves outcomes. It improves outcomes for our treatment plan. It improves outcomes for the family's involvement and participation. Compassion helps to build trust with the family, And respecting other cultures outside of your own leads to better collaboration. And it also leads to learning. You know, why wouldn't we want to learn more? And leads to more experience. So a successful behavior plan adapts to the individual, not the individual to the plan. That's like the number one key takeaway from the training. Does anyone have any questions? No? Okay. It was a shorter training today.
It was a great training on it. Well done.
Thank you. Yeah, and if anyone has any questions about it, please reach out. And thank you guys. I hope you enjoy the rest of your day. Thanks for joining us.
Thank
Thank you
you.
guys.
Thank
Thank
you.
Hey, Grace.